Dosing and administration. Medical cannabis is contraindicated. Remember that the brain is being formed until the age of 25. So no THC. If you consume too much THC too young for too long, you start having language disorders and you start having, less desire to move forward. Breastfeeding, history of cannabis, hyperemesis, history of cannabis use disorder, psychiatric unable mood disorder. If you have any psychiatric illness like schizophrenia or psychosis, you should not use cannabis. Untreated substance use disorders, you're addicted to opioids, but we've seen that patients that are on opioids consume less opioids if they do take cannabis, but if they have another substance abuse disorder, we don't want to put another abuse disorder, so that's why we screen it and we don't usually recommend it. We recommend you being sober for 6 months before we start it. Thank you for the water. Relative contraindication in the use of central nervous depressants. Having said that, gabapentin is a central nervous system disorder, depressant, and we use it all the time for neuropathic chronic pain, so this is relative. Cannabis use disorder. Just like any other disorder, you're asking for more and more drug. Most of the patients asking for medical cannabis aren't looking to get high, aren't looking to escape reality. They're looking for resolution of their quality of life. They want to sleep a little bit better. So they're not asking for more and more and more and more. 1 gram is, correct me if I'm wrong, about 2.5 joints. Most patients don't even take a joint. They take half a joint. In equivalent, I suggest oils. You can vaporize it as well, but I suggest oils or other forms of absorption. So if you're asking for more and more, your social network is saying that, hey man, you're consuming way too much here. This is costing a fortune. Difficulty reducing the use. You've got anxiety. You've got problems when you withdraw. You can't perform at work. You can't perform at school. You've got poor social functioning, then you've got a disorder. You're consuming too much. Alcohol, other forms of medications. So that is a problem, and that's something that we screen for when we prescribe it.